All right, this is lesson number 20, CPR and automated external defibrillation. All right, we have a scenario here in which you are the emergency medical responder. A man suddenly collapses. He is lying on the floor and does not appear to be moving. You, as a police officer trained in emergency medical response, recognize the emergency, activate the emergency response plan, and perform a primary assessment. The emergency medical services EMS system has been activated. You determine that the man is unresponsive. He has no severe life-threatening bleeding, is not breathing normally, and does not have a pulse. You have an automated external defibrillator, AED, in your patrol car. So what would you do under these circumstances? This is a scenario that we will discuss for the in-person session. Okay. So next slide here we have CPR. Okay. So what is CPR first? CPR is cardiopulmonary resuscitation. That's what CPR stands for, okay? And the CPR consists of cycles of chest compressions and ventilations, okay? Cardiopulmonary resuscitation circulates blood that contains oxygen to the vital organs of a patient in cardiac arrest when the heart and normal breathing have stopped. CPR includes chest compressions and ventilations, as well as the use of an AED. For adult patients, CPR consists of 30 chest compressions followed by 2 ventilations. High quality chest compressions, okay? Patient is on a firm, flat surface. Patient is on a firm, flat surface to allow for adequate compression. In a non-healthcare setting, this would typically be on the floor or ground, while in a healthcare setting, this may be on a stretcher or bed with a CPR board or CPR feature applied. Next, we have chest is exposed. Chest is exposed to ensure proper hand placement and the ability to visualize chest recoil. Next is arms are as straight as possible with the shoulders directly over hands. Hands are correctly positioned with the heel of one hand in the center of the chest on the lower half of the sternum, while the other hand on top. Most responders find that interlacing their fingers makes it easier to provide compressions while keeping the fingers off the chest. Next is compressions are given at the correct rate or of at least 100 per minute to a maximum of 120 per minute, and at the proper depth of at least 2 inches, but no more than 2.4 inches for an adult to promote adequate circulation. Next is chest is allowed to fully recoil between compressions. Chest must be allowed to fully recoil between each compression to allow blood to flow back into the heart following that compression. So the next slide here we have ventilations. Ventilations is air is forced into the lung. Okay, that's how ventilations are provided. Mechanisms can include mouth to mask ventilation, so you can use a mouth to mask, bag valve mask resuscitator, mouth to mouth ventilations, or mouth to nose ventilations. Okay, it's not ideal to use mouth to mouth in an extreme emergency. You kind of taking a risk there due to possible, diseases and things that can be transmitted. All right. So now we're going to talk about one responder CPR. For one responder, hand position, okay, you use two hands at the center of the chest for an adult and a child, okay? And then for an infant, you're going to use two fingers in the center of the chest just below the nipple line so that you're not run the risk of using too much power, okay? Now the chest compression depth is for an adult, 2 inches. So you're going to press in 2 inches and also 2 inches for a child. 1.5 inches for an infant, okay? Because their chest is going to obviously push in a lot easier. The ratio is 30 chest compressions per every 2 ventilations. So 30 chest pumps, compressions for every 2 ventilations, okay? Now we're going to talk about what's required for a 2 responder CPR. Responder 1 performs the scene size up and primary assessment and begins the process of providing CPR. Responder 2 calls for additional resources and prepares the AED if available. Responder 1 continues to provide high quality CPR until Responder 2 is ready to assist and or the AED is ready to analyze, okay? Now this is 2 responder CPR continued. Compression to ventilation ratio, okay? You're gonna go for an adult, you're gonna go 30 chest compressions and 2 ventilations. And for a child and infant, you're gonna go 15 chest compressions to 2 ventilations, child and infant. Position change about every 2 minutes. And the reason why you want to change this position is to avoid fatigue, right? It can be fatiguing. You have your adrenaline going, you're pushing down, exerting all that energy, you get tired. So you switch it around so a guy didn't have to spend an entire time doing compressions. And you end up with 2 more victims. Okay, now this is an appropriate time where you want to discontinue CPR. Okay. Okay. Do not interrupt CPR for more than a few seconds. Okay. Do not stop CPR except of one of these situations. You see signs of return of spontaneous circulation. Right? You see the person, they're breathing, they're okay. You're not going to continue CPR. It might hurt the person. An AED is ready to analyze the patient's heart rhythm because it's going to, maybe provide a shot. It's time to stand back. An AED actually gives you a warning to stand back. Other trained responders take over. So if you're an EMR and you get, paramedic, someone come, ambulance, some, higher level of training, you're going to get out of the way and let them do their thing. You are presented with a valid do not resuscitate, a DNR order. Okay, so that's going to is going to supersede you wanting to help out. That's the final order. You are alone and too exhausted to continue. So if you are on your own, you've been doing CPR and in bad situation, that can be bad for both of you. If you've done all you can, you don't want to risk possible health hazard. The scene becomes unsafe. You could be doing CPR on an individual who has family around. They can be hostile and it might not be a safe environment, or it can be another scenario which is a possible hazard, which makes the environment possibly unsafe. All right, so we have automatic external defibrillators, all right, AEDs. What is an AED? AEDs are portable electronic devices that analyze the heart's rhythm and provide an electrical shock to help the heart reestablish an effective rhythm, kind of try to like jumpstart the heart. Rhythm is monitored using 2 electrodes placed on the chest, okay? All right, so we have common life-threatening heart rhythms, all right? So you have the ventricular fibrillation, the VFib, or you have the ventricular tachycardia, okay? So the most common abnormal heart rhythm that causes sudden cardiac arrest occurs when the ventricles simply quiver or fibrillate without an organized rhythm. This condition is called ventricular fibrillation. In VFib, the electrical impulses fire at random, creating chaos and preventing the heart from pumping and circulating blood. Okay? Another less common life-threatening heart rhythm called ventricular tachycardia occurs when the heart beats too fast. In VTach, an abnormal electrical impulse controls the heart, originating in the ventricles instead of in the SA node. This abnormal impulse fires so quickly that the heart's chambers do not have time to fill, and the heart is unable to pump blood effectively. With little or no blood circulating, there may be no pulse. As with VFib, there is no breathing or pulse. Okay, so these are the conditions in which you should use an AED. The patient is unresponsive, okay? There's no normal breathing. There is no detectable pulse, which is, sign not a good thing, right? Okay, so we have some general steps for operating an AED. Turn on the AED first, right? Expose patient's chest and wipe it dry if necessary. Attach AED pads to patient's bare, dry chest. Allow AED to analyze a heart rhythm, okay? Deliver a defibrillation shock if indicated. So these are the basics. This is the function, the general steps of how to use AED. Of course, it might vary in situations where you might have only adult pads with a child or an infant and things like that, or different variables. Someone has a pacemaker, but these are the general steps under normal conditions. Now, here are AED precautions, all right? Do not use alcohol to dry the chest, okay? Don't use alcohol to dry the chest. Use appropriate size pads for the patient. Remember, they have, smaller pads, larger pads for adults. Do not touch the patient while the AED is analyzing or during defibrillation. Okay, that could be dangerous. Do not defibrillate around flammable or combustible materials. Do not use an AED in a moving vehicle. Do not use an AED on a patient who is in contact with water. Electricity and water don't mix too well. Do not use an AED on a patient wearing a nitroglycerin patch or other medication patch on the chest. Now we have special AED situations. Pacemakers and implantable cardioverter defibrillators. Water. Freestanding rain, wet clothes. Transdermal medication patches. Hypothermia. Trauma. Chest hair. Jewelry and body piercings. Okay. Okay, so this is a high performance CPR. So high quality chest compressions are provided as part of a well organized team response. All right? Coordinated, efficient, effective teamwork is essential. So this is giving an overview on high quality CPR done properly, organized team response, quality chest compressions, and teamwork, okay? All right, so now we have chest compression fraction. Chest compression fraction denotes the proportion of time that the chest compressions are performed. Expert consensus identifies a CCF of at least 60% with a goal of 80%. To achieve the best CCF percentage, a coordinated team approach is needed. This coordinated team approach includes integrating and assimilating additional personnel. Okay. So we have the next another scenario here, in which we'll discuss in person. You are the emergency medical responder. The man who collapsed is unconscious, is not breathing normally, and does not have a pulse. He has no severe life-threatening bleeding. You send another responder to summon more advanced medical personnel and to bring the AED. You begin CPR. Once the AED arrives, the other responder prepares the AED for use. And that concludes lesson 21.